Hello, my name is Dr. Marisa Mazza, and I'm a psychologist here in the San Francisco Bay Area. Most of my practice is focused on supporting folks with anxiety disorders, OCD, and other kinds of stressful problems. The main modes of therapy that I use are evidence-based, and that includes exposure and response prevention, as well as acceptance and commitment therapy. Throughout the years of my training, I feel very lucky to have been exposed to a number of world-renowned researchers, mentors, and my hope for these videos is to share some of the information I've learned. That way, more people have access to some of the wonderful information that's out there. It will help you live the life that you want to live and deserve. In today's first tips, I thought it might be helpful to start at the beginning with what is OCD? It often takes many years for individuals to get a proper diagnosis. Most of the clients that come into my practice are actually self-diagnosed. They have done their own research because after meeting with a number of clinicians, they found little to no effectiveness in the work that they were doing. So let's start at the beginning. What is OCD? OCD is considered a disorder that includes obsessions and or compulsions. When I say obsessions, what I'm really referring to are intrusive, unwanted thoughts or urges. And these thoughts or urges are usually associated with either anxiety or disgust. Then, compulsions. The majority of people will have both obsessions and compulsions. In my experience, all of my clients have obsessions and compulsions. Every once in a while, I'll have a client coming to me saying they have pure O, and through further assessment, what we identify is that there are some kind of mental compulsions. So the way that we define compulsions are repetitive, either physical or mental behaviors that a person engages in to try and reduce or neutralize the obsession, the anxiety associated with the obsession, or the disgust associated with the obsession. So, for example, a common obsession and compulsion in a relationship OCD might look like an obsession could be an unwanted thought around whether or not their partner is right for them. A common compulsion might be seeking out reassurance. So asking the partner questions, maybe to analyze and test whether or not they're giving the responses that a perfect partner would give. The reason why OCD is considered a disorder is that typically these obsessions and compulsions will take up at least an hour of the person's day, and it will have a significantly negative impact on their life. So some of my clients with OCD will report having struggles sleeping, having trouble being able to just enjoy their leisure time, engage in hobbies. They'll also report problems at work or in their relationships. If you're not sure whether or not you have OCD, one suggestion would be meeting with an OCD specialist. Unfortunately, not every therapist is trained in OCD. Specialists do have specific training in how to identify and treat OCD. One way to find out about who these providers are is to go to the International OCD Foundation website, iocdf.org. They have a provider directory on their website. You can enter your zip code and find out who all the OCD providers are in your area. I really appreciate you taking the time out of your day to watch this video. I hope this was helpful, and I look forward to sharing more information with you.